The opposition, Senator Plett.
Thank you, Chair. Thank you, Ministers, both of you, for being here and for the difficult times that you are taking us through. I also want to take just brief seconds to recognize Dr. Tam, who's with us, and thank you for all the work that you do. My questions in the first round are for the Minister of Health. So, Minister Hajdu, I need to try to get them all in, so if your answers would be as succinct as possible, I'd appreciate it. And I'll try to be the same. There are many people, Minister, who are rightfully concerned about the healthcare system prior to COVID-19. That level of care may be diminishing due to the pandemic. And I'll give you a brief example of a young woman in Ontario receiving cancer care. Medications she received intravenously now have to be taken orally. Tests to monitor her levels, which were previously conducted several times a week, have been reduced to once a week. She knows these changes and others are to protect her and her medical team, but it is still a very difficult situation. I am certain other Canadians find themselves in similar circumstances, Minister, and what do you say to patients across Canada with pre-existing conditions who find their normally excellent level of care reduced dramatically? How long do you think this will be their new norm?
Well, thank you very much, Senator, for the question. And the first thing I will say is that my heart goes out to all of the patients who are being asked to postpone elective surgeries or procedures that in some cases is creating a great deal of anxiety or changes to routines that they have. I will again thank our medical professionals across the country who are working to balance very critically the need to make those decisions and reflect on how they reduce their occupancy in some cases in hospitals or their particular loads to prepare for what we know is the coming peak in the weeks to come. This is obviously an unprecedented situation in Canada, and although we have a public health system of which we should be incredibly proud of, and most Canadians are, it has been stretched for a very long time, as we know, and it is additionally stretched now as we see our cases rise in Canada. And this is a time where all Canadians are making sacrifices, and I don't hesitate for a moment to know that those are deeply personal and individual, and in some cases quite significant. And so I thank the woman that you're speaking about for her capacity to work with her healthcare provider to find alternative routes to receive her treatment. I anticipate there are thousands, if not hundreds of thousands of Canadians who are in the same situation as our healthcare system prepares for an onslaught of patients in the way that we have never seen.
Minister, how will you ensure that Canada has an adequate supply of blood during this crisis? Have you spoken about the blood supply with your provincial counterparts? And what happens if we go into a lockdown? Can you assure this chamber that a process will be put in place so that people who want to donate blood can do so safely?
Well, thank you, Senator. And we have seen a decline in blood donation during this time, which is why Dr. Tam and I have appealed to Canadians to continue to donate blood. It's very important that people who can do that and have the capacity to do that continue to do that, because maintaining our blood supply is a critical need in the best of times. In terms of lockdown, I think we have to be very careful when we use the word lockdown, because it can mean various things. In some ways, our country is locked down. We are no longer accepting passengers from international destinations. We have a variety of different measures across the country based on which province you live in that are very and significantly limiting people's lives. We do those things at the federal level with the balance of trying to protect people's ability to make their way through their everyday life and balance the need to ensure increased social distancing, for example. These are not easy decisions, but I think when we use the word lockdown, it means very many things to very many people, and we'll just have to be careful that we don't have that we're not using it in a way that implies one thing.
But will we have an adequate supply of blood?
For that question, I'll turn to Dr. Tam. I know she's been working on this issue.
I just want to reassure Canadians that our blood system, the Canadian Blood Services and Héma-Québec, have put in amazingly stringent measures to ensure the safety of blood donors in their clinics. So they will pre-screen, they will not let anyone sort of get into those donation clinics if they have symptoms. So it is very safe to donate blood. And we have seen, given the messaging that we have so far, that Canadians are responding. And so I ask that they all continue to respond in order to keep our blood supply as needed. But we are seeing Canadians step up, and they just need to keep going. Thank you.
Senator